Hello everybody, this is Plainfield Chiropractic. I'm Dr. Chris Smith and this is Dr. Mike Smith, Naturopathic Doctor here at Plainfield Chiropractic. And the question is today, did you know chiropractors and naturopathic doctors can help treat postpartum women with many different conditions? Specifically, I'm going to go ahead and talk about that strong postpartum back pain that develops. So with this postpartum back pain, it definitely goes ahead and it slows down mom when she has this young baby. Now, how does it develop? First off, there's quite a few things that can cause this lower back pain to develop. First off, if they had a spinal condition prior, that's something right there that can go ahead and exacerbate symptoms with lower back pain as they go ahead and go through the pregnancy, but then also the delivery. Also, along with that, when we go ahead and mom has, unfortunately, bad posture, which isn't uncommon considering now you have to go ahead and you're carrying around a baby carrier. And on top of it too, when you're breastfeeding, you're having to get into different positions to make it comfortable for the baby. You also need to think about yourself. You have to have the proper positioning, proper posture, so your back pain doesn't get exacerbated. So along with that too, another thing is looking at weight. Weight's something else too that needs to be addressed, because still, if you continue to carry on the weight you had from pregnancy, that can continue to linger with this lower back pain that you have. So there's so many things that we're able to go ahead and address. Chiropractically, we can go ahead and address this too through chiropractic adjustments, manipulation, taking pressure off the lower spine in terms of the nerves. And then along with that too, we can also go ahead and through diet nutritional changes, that's something else that we can go ahead and address too. Dr. Mike is here, who's also going to go ahead and now talk about everything that he can do naturopathically to help with these postpartum mothers.
Yeah, so one of the first things that I think about, Dr. Chris, with postpartum moms is their breast milk supply, breast milk production. This is something that new moms are always concerned about. It is very, very prevalent, so it gets talked about a lot. And for those moms that want to do everything naturally, right, this will weigh on them heavily if they feel like they're not being able to produce that nutrition for their young. So it's important to support them and let them know that this is common and that there's things that we can do before we get to the formula and supplement. So one of the first things I think about is hydration. Simple, easy, making sure that you're taking in enough water. Typically half your body weight in ounces is a good place to start, good rule of thumb. The second thing that I think about is different botanicals to actually increase the breast milk supply. There's a lot of different botanicals, but it's important to take botanicals that are going to be safe in lactation, because there's many botanicals that are not safe in lactation. So that's the most important thing. The top 3 herbs that I think of that actually increase the breast milk supply are fennel, fenugreek, and hops. The 3 best. And then there's some other ones that can support hormone production as you continue on, like blue vervain, chaste tree berry, things like that. So other things that I discuss with new moms. And then, of course, one of the other things that is also prevalent with postpartum moms is those mood disorders, right? The baby blues. It is very prevalent as well. Some studies suggest up to 40% of women will have some sort of postpartum depression. Fatigue, feelings of irritability, things like that. And it can come and go. It can wax and wane over the course of that first year, those first 12 months, and it can linger on past those first 12 months too. So one of the first things that I think about, it's important to take care of your physical body so that you can support your emotional health as well. So eating a colorful whole foods diet is the first thing that I think about. Of course, hydrating yourself properly. The next thing is having your community, having your support network around you to either take care of your other children that are screaming and running around, or splurging and getting some child care so that you and baby can have some bonding time, some alone time to each other to bond, because that's very important. And then sleep, of course, is the most important thing, and new parents just do not get enough of it. So having family around, having your support network, someone who can take baby for a little bit so mom can get an hour or two. This guy right here knows exactly what I'm talking about. And then the other thing that I think about is stress reduction techniques. So different breathing techniques is what I think about. Specifically slow and diaphragmatic breathing. The diaphragm is that large respiratory muscle that sits over the top of our abdominal organs, and it's directly connected to our parasympathetic nervous system. So that's that rest and digest, rest and relax nervous system. So that's the key, is slow and diaphragmatic breathing. And then a couple other things that I think about when it comes to the fatigue with postpartum depression. B12, great supplementation to help with that fatigue. Another one that I think of for postpartum depression is essential fatty acids, those omega-3s. Pretty well studied. It tends to be very, very high dosages, so 10 to 12 grams per day, so pretty high. And then the other thing that I think about is nervine herbs and adaptogenic herbs to, one, calm the nervous system, and two, support the adrenal glands in that stress response. So that's what I've got for today.
All right. Well, we want to thank everybody for watching today. Again, Plainfield Chiropractic here in downtown Plainfield on the corner of James and Lockport Street. This is where our office is. As you have myself, Dr. Chris, and then Dr. Mike, who's over here. We just want to say thank you so much for watching our video. Like us, love us, share us, comment. If you have any questions about anything, go ahead and you can also PM us. We're happy to address anything that you want to go ahead and talk about in terms of any conditions. Also with obviously postpartum. All right, you take it easy. Have a great rest of your day.
Thank you.
Bye-bye.